So low dose naltrexone is one of the medications on the compound side that I've just seen pretty amazing results of what else happened in terms of our pharmacy. Keep in mind, you've got to understand how low dose naltrexone works is understanding the immune system. So our body naturally produces a reaction when we have something that comes across in terms of our immune system. And let's say, for instance, that we have a situation that a person, let's say you get a bug bite on your skin. So our body wants to resolve that and take care of the issue of the bug bite. So what happens is your body sends a bunch, you see the redness, you see the inflammation, you have the itch, you have all the things you typically think of an inflammatory reaction that happens at the skin level. But what happens is the body goes there, takes care of the bug bite, and then the next thing you know, over the next days, the redness goes away, the inflammation goes away, the itching goes away, and the immune response is gone. And that's basically the same thing if we have a cut on the skin, or basically if you bump your head and you have a big red knot that comes up. Our bodies are very amazing to be healing and to take care of when our body gets damaged or injured. And that's a natural process. Same thing happens if we get attacked by a virus or a bacteria, COVID-19, for instance. It triggered an immune response. And I'm sure many of you have seen and heard throughout the COVID response, it wasn't so much that COVID was the bad guy. It was in our immune system and trying to take care of our body and heal and get rid of COVID that it got out of balance and caused problems. So keep in mind, when we have an attack, a cut, an infection, through all of that, that is what's called an acute, short-term. The body goes in, takes care of, fixes, cuts off, things go back to normal. But what we've learned is over the last several years that our immune system can get hyperexcited, can get overstimulated, and unfortunately, it doesn't cut off. And when that happens, we get a state of chronic or long-term inflammation. And that chronic inflammation sets up for a whole host of bad things. Short-term, clears things up. Long-term, it cuts on a lot of processes that have negative effects. And unfortunately, there are many things in our daily life that make our immune system have a difficult time in controlling inflammation. And those are like diet. Unfortunately, a modern American diet full of processed foods, a lot of sugar, a lot of bad fat, sets up a gut environment of inflammation, which feeds the system that can cause problems. The next thing that causes a lot of inflammation is obesity. Sadly, when we carry fat on our body, a fat cell in the body is like an inflammatory manufacturing station. It spits out chemicals throughout the days that turn on all type of inflammatory processes in our body that make it very difficult for the inflammation process to cut off. Next thing is stress. When we have stress, our body begins to make certain hormones that can have an inflammatory state that can set us up for other disease, but also stress causes an effect in our gut. You'll hear me talk a lot about our guts tonight, about it causes a situation where we have our guts get holes in them, where we absorb and do things in our gut that we shouldn't, and that can trigger an immune response in our body. It's a hyperpermeable state where the body leaks out contents that it shouldn't, and that triggers an inflammatory response. Infections. COVID is a classic example. Our body goes to try to fight it, it gets cut on and it can't cut off. Toxins and pollutants, whether it be in our water, in our foods, in our environment, it could be you have mold in your house. That chronic stimulation of our immune system never gets a break, which sets us up for problems. Poor sleep, our body has to heal, especially in our brain. There's a lot of brain inflammation that happens when we don't get good quality sleep. And inactivity, sedentary lifestyle. Believe it or not, being active on a regular basis allows our body to heal. And what happens is when we're inactive, we don't make a lot of the factors that allows our body to produce or cut off inflammation. And unfortunately, and if you've been in my store and you've ever heard any of our lectures, whether it be from me or any of my pharmacists, almost every modern disease we know today is basically a function of an out of control immune system. So that kind of leads us into where we're going with this whole talk. So one of the things that's unique to get into understanding how low dose naltrexone works is you have to understand in our body the endorphin system. And the endorphin system is our own natural opioid. We all know what an opioid is. It's like the morphines and the codeines and all that thing. Our body naturally makes a substance called endorphin that works in the brain to control inflammation. And what it does is, control pain. But what's really unique, these opioid-like receptors are on all parts of our body. They're in all the organs of your body, but also they set on the immune system. And by having a receptor on the immune system, every time we produce our natural opioids, it can control our immune system's ability to affect all the systems that we talked about. These natural endorphins also create a sense of euphoria, a sense of feeling good. They modulate our appetite, and they also control our immune system. So now you understand, have a hyperactive immune system. We actually understand now we have endorphins over here that are a good thing. They help control pain. And now we're going to kind of talk about how it all kind of goes together. So the endorphins, like you said, promote healing. They also, by controlling the immune system, they inhibit excessive cell growth. We think about cancers. Unfortunately, when we understand cancer, cancers are our own cells that for some reason just decide to start growing at a rate that they shouldn't, and that creates a bad problem. Well, endorphins have ability actually to regulate some of the genes that control cancer and cell growth. They reduce inflammation by helping control the immune system. There's also something that's called a part of our immune system that signals the immune system to go out and attack and do things. Endorphins actually calm that system so our immune system isn't overly hyper responsive. The next thing is it helps create a euphoria, helps us to feel good, sense of well-being, a sense of satisfaction. And then, because if we block our endorphins, unfortunately, we tend to be kind of flat. We don't have a lot of mood. We don't get excited about anything. So those are some things to keep in mind as far as that goes. And then the last thing is they produce natural analgesia, which is pain relief. The one thing that I like to tell patients to think of in terms of what can we do to help our own bodies make our own endorphins? And it kind of goes back to the first thing I talked about. What are the things that are opposite that create inflammation? And that's going to be exercise, makes us make endorphins. Meditation makes us make endorphins. Social interaction, just interacting and talking to people can do that. UV light, something just, believe it or not, just actual sun exposure can do that. And then the other thing that can sometimes do that is actually acupuncture. So that's the other thing to kind of keep in mind of things that can actually allow your body to make your own natural endorphins as far as that goes. Just one quick reminder, if you're not muted, if you could please do so, we'd greatly appreciate it to do that. It just kind of makes for an easier presentation. So let's talk about naltrexone. We did, early on in the days, naltrexone was a drug approved in 1984 as an opioid blocker. Unfortunately, this was the early days when opioids kind of came on the market. We started having some abuse issues, and people were actually overdosing on opioids like morphine, even things like heroin. And what thing was, naltrexone was a derivative of a drug called naloxone, which was the original drug. It had a really short half-life, which means we could give it to somebody in an overdose situation, but unfortunately it got out of the body very quickly and it wouldn't control an overdose. So naltrexone was approved in 1984 as a drug to reduce or block opioids. And it can be taken by mouth, and it worked really, really well. We used doses like 50 to 300 milligrams to basically reduce somebody who either maybe overdosed on a narcotic, but also too, we found out because of its effect to kind of have remember it blocked opiate. We talked about it, blocked our natural endorphins. Remember those endorphins, or it kind of give you like a false high or make you feel good. By blocking our own natural endorphins, what we found is that people kind of they didn't get the excitement over normal things, i.e., let's say you're one to tend to drink a lot of alcohol because it makes you feel good. Well, believe it or not, naltrexone at high doses could actually block that effect. So then it got later approved in the 90s to be used for people to cut people's cravings for drinking. Because these endorphins in the brain have a lot of effects on different things. Like you said, how you feel, craving, pain, euphoria, all of those things. So those are all the different things that are really, really important in terms of what the opioid blocker naltrexone can do. So it was indicated for the treatment of alcohol and opioid addiction. The other thing that it was that it was used, once again, keep this in mind, of doses between 50 to 300 milligrams. And that is very, very important to understand the effects of what naltrexone did. So that's kind of our introduction to naltrexone. So moving forward, let me go to the next screen. Let's talk about low dose naltrexone. So as with most things in pharmacy, and we learn this, is a lot of things we find out by accident. So later on in the development of naltrexone, it was discovered that there are opioid receptors on our immune system. And there was a doctor in New York in the early days of HIV that knew, when you think about HIV, what we know now, remember we got a virus, it attacked our immune system, the CD4 cell, and that CD4 cell became non-existent. And unfortunately, people did not die of HIV, they died of opportunistic infections because the immune system wouldn't work. So Dr. Bahari in New York remembered reading something about there is an opioid receptor on the immune system. And what he had an idea was, well, what if we try a little bit of this naltrexone and see what it does to the immune system? And to his amazement, what he found is at a little bit, very low dose. Remember, alcohol addiction, opioid addiction, 350 to 300 milligrams. With low dose naltrexone, we're talking 1 or 2 milligrams. We're talking very, very small doses. And what he found out early on, before we had any of the HIV medications, low dose naltrexone actually had the ability to increase somebody's immune system where they could actually fight infection. And before they had HIV drugs, Dr. Bahari's patients were living longer than the average patient because their immune systems were stronger. What's kind of crazy that we know about low dose naltrexone is, remember what I just told you, it took somebody's immune system that was weak and actually made it stronger. What's really unique, and we're going to talk about the rest of this, is we talked about inflammation, and inflammation a lot of times cuts our immune system on and makes an overactive or a hyper responsive immune system that causes inflammation, that causes like many autoimmune conditions. And we'll talk about that in a second. And what's amazing is low dose naltrexone modulates the immune system. It doesn't cut it off. It doesn't cut it on. But what it does is, if the immune system needs to be calmed, it will calm the immune system. In these case of these HIV patients, if the immune system is suppressed, it'll actually stimulate it. Think of it like a smart drug. There's not a lot of things that do that on the market. Unfortunately, with a lot of autoimmune conditions, we use drugs that are called biologics. And biologics, we've learned, and keep in mind with an autoimmune condition, if you're not aware of that, unfortunately, there's about 105, 106 different autoimmune conditions. And it's a situation where the body recognizes something that's part of you, your thyroid gland, your nerve cells, your muscle structure, your skin, but your body recognizes a part of you as a foreign invader, like a bacteria or virus. And our immune system gets hyper responsive and it goes, attacks it, and it creates an autoimmune response. Well, that's one of the really awesome things about low dose naltrexone. Low dose naltrexone can calm that reaction. With many autoimmune conditions, and you see these commercials on TV every day, there are what are called biologics. And biologics go to work on autoimmune conditions by actually going in and shutting off the immune system. Well, that's good because now the body doesn't attack itself anymore. But when we cut off our immune system, it has two problems. One, it increases our risk of infection because now our immune system can't fight the bad things that come along the way. The other thing that happens is, and we talked about all this, how this works together, it increases our risk of cancer because our immune system can't keep cancer cells in check. Sadly, we all have cancer cells in our body, but our immune systems are phenomenally great at keeping them in check and getting rid of them. But when we do biologics, if you listen to all those commercials on TV, they say increases your risk of infections. If you get a sore throat, run a fever, contact your doctor immediately, but they also increase your risk of cancers. And that's one of the neat things about low dose naltrexone. We'll talk about this. In modulating the immune system, it keeps the immune system in check, doesn't push it far one way or the other, shut it off or keep it calm. So let's talk about low dose naltrexone. So low dose naltrexone, like we talked about, has kind of the opposite effect. And basically what happens is this, it's pretty simple. So remember we talked about our body makes its own endorphins. And when it makes its endorphins, it has a positive effect. So what low dose naltrexone is if you have an opioid receptor, low dose naltrexone goes and sets on the opioid receptor for just a few minutes and blocks it in the body. So what happens is the body says, oh my gosh, what happened? My opioid receptor's blocked. Naltrexone is very unique. At a low dose, it gets in the body real quick and it gets out of the body real quick. So what happens is it sets on the receptor. The body's like, oh my gosh, all my opioid receptors are getting blocked. I need to make more endorphins. Then your body releases its own endorphins when the naltrexone leaves the body. And the next thing you do, you get increased levels of your own endorphins. That's what Dr. Bahari found out in his patients was they would make 300 times more endorphins than they would by not taking low-dose naltrexone. And remember, we talked about all the benefits of your endorphins on the previous slides. They improve pain, they normalize the immune system, and they actually regulate cell division in normal and abnormal cells. They also have analgesic properties, work with pain. They reduce and work as anti-inflammatories. They're neuroprotective. They reduce inflammation in the brain, all by just this little naltrexone blocking this opioid receptor. The other really unique thing about low-dose naltrexone and this on and off phenomenon, it actually works in your brain. Your body makes dopamine. That's the feel-good chemical that your body makes when it gets excited. So anytime we have a craving or we do something that we feel like is like an addictive type nature, addictive behavior, the reason we do all those things is to get that little dopamine hit. Believe it or not, they look at things in the brain like an Oreo cookie. And we laugh about this all the time. We teach our weight loss in our food classes. You can actually take and monitor the dopamine levels in the brain when you eat an Oreo cookie. You actually get higher dopamine levels in your brain when you eat an Oreo cookie than if you do cocaine. And that's because that's just the way the food's made. But what's really unique about low-dose naltrexone sits on that opioid receptor. It does a similar thing. It makes a little dose of dopamine hit your brain. And we'll talk about why that's important in a minute. So just want to kind of look at that. I'm going to look at the chat real quick to see what kind of questions we got. Let me see. I see one of the ones, has this been there? Research trust over, yeah. And so what's really awesome about the research trust, and we'll talk about that at the end, some of the awesome things you can learn a lot about some of the conditions as far as that goes. So we'll move forward. So let's kind of talk about the dosing. Everybody with low-dose naltrexone has their own sweet spot. And what I've learned through the years is everybody is very unique. And I'll tell you what I've seen over the years is that it seems we're starting with lower and lower and lower doses. Typically, most people fall in this range of about 1.5 milligrams to 4.5 milligrams once a day at bedtime or in the morning. Keep this in mind. Everybody is different. We have all type of dosing ranges. Sometimes we go higher than that. But I want you to keep in mind, and this is kind of why the drug is safe and it doesn't have a lot of side effects. Remember we talked about before when this drug was originally developed, 50 to 300 milligrams. In our patients, we use low-dose naltrexone. We only use 1.5 to 4.5 milligrams with most patients. With most patients, what we do, we start out with a 0.5 milligram tablet or a 1.5 milligram capsule. And what we do is we start out and we have patients take that dose once a day. When you take that during the daytime, what we do is we say the next day, as long as you're feeling better, notice no change, and as long as you have no side effects, after 7 days of doing it one a day, we'll go to 2 capsules. For the next 7 days, we'll take 2 capsules, and we're going to monitor again as long as the 3 things. You're feeling better, you notice no change, and as long as you have no side effects, we'll work our way up to 3 capsules. And once again, whether you start at a 0.5 or a 1.5, we like to work up to that 4.5. There are some conditions we may talk about later that we do higher than that. But once you get to that 4.5, that's our goal, is to work you up to that dose. And then we'll monitor you from there. But everybody has their own sweet spot, because what we've learned is you may start taking the drug once a day for a week, you do great. You go to 2 a day for a week, you do great. You go to 3 a day for a week, and all of a sudden, boom, you get a stomach upset, or you get a headache, or you don't feel good. It doesn't mean you can't take the drug. It just means, one, you're really sensitive to it, and we're going to drop back to where we were, and your sweet spot dose may just be a little less. That's one of the challenges sometimes we see with practitioners. If they don't kind of understand this, they'll just start somebody on the 4.5, and I've seen some patients that do great with that. But then we also see some patients that 4.5 is just way too much, and they're like, oh my gosh, I took it and I got a headache, or my pain got worse. I don't want to take the drug. And I'm like, whoa, wait a minute. It doesn't mean you can't take it. Maybe your sweet spot dose is a little lower, and we have to work through that. The only drug that we really can't take with this is narcotics, because what happens is, let's say you're taking a pain pill every day for some type of a medical condition. Well, what happens is with those patients, lots of times your body gets dependent on having that pain med there. And all of a sudden, if we give you low dose naltrexone, even though it's in the body for a short time, it'll come in and knock that pain medicine off of the opioid receptor, and the body can go into a pain crisis. I mean, it can send somebody to the emergency room. It's very scary. But what we've learned is, instead of doing low dose naltrexone, we do something called ultra low dose naltrexone, which we found is you can actually be on an opioid, and we can take and give you, look at these doses down on the screen. You can do 5 to 25 micrograms. That's like 1,000 times less than the dose we're given with low dose. So it's even lower. But what we have found is that low dose, we can still give the opioid. We can give the ultra low dose naltrexone. And what we found is it sensitizes that opioid receptor so that the pain medicine you take works a little better. You also make some of your own natural endorphins. And we've even found patients that have been able to lower and actually get off of their pain med because we can work the dose up slowly, work the pain medicine away. The key is we only can give certain pain meds with it. We can't give long-acting pain meds. And what we do is we try to give the low-dose naltrexone or the ultra-low-dose naltrexone at a different time of the day. But it's one more way that it can be used to help patients with pain. So we've had some really, really good luck with that as far as that goes. I was going to kind of stop for just a second and kind of go through. I tell you what, I'm going to leave questions at the very end. So just hang with me. Please keep posting them in there, and I'll make sure that we go through this when it's all done, because I see some of the things that I have good things. So keep in mind, low-dose naltrexone, also known as LDN, that's how I'm going to say it from now and then, does require a prescription from a doctor. And I see one of the questions is how do we get our doctor to write it? And we're going to talk about that. Keep in mind, once we find the sweet spot dose, we want to give ourselves 3 to 12 months to see the benefit. And we'll talk about the reason why that is. I say at least 3 months. For some conditions, I say 12. The neat thing about low-dose naltrexone is if you don't see any benefit over that time, get off of it. You can stop it cold turkey. It won't hurt you at all. There's no addiction potential to it. It's not a controlled substance. That's what's awesome about it. The next thing that I like about low-dose naltrexone is that it's one of those type things, depending on the condition. I usually try to say 3 to 6 months, but I'll tell you, we use it for a lot of skin inflammatory conditions, and those tend to be a little slower to respond. So let's say you're going to use it for psoriasis or something like that on the skin. 12 months is really kind of what's needed. The other thing we've seen, we do some weight loss combos. Remember we talked about how low-dose naltrexone can have an effect on your dopamine levels, and that can affect cravings, and that could be from anything from alcohol cravings to drug cravings to food cravings to you name it. What we've learned is if we take low-dose naltrexone and we dose it multiple times a day, we can have really great effects on cutting food cravings, cutting and reducing inflammation. People talk about all the time, I can't lose weight. Well, when our bodies are inflamed, and unfortunately so many people are inflamed, your body just won't drop weight. So we do some weight loss combos with low-dose naltrexone. The crazy thing is we're using it for low-dose naltrexone, but then we see other benefits in terms of mood and things, and we'll get into that. But sometimes we won't just dose it once a day. We'll dose it multiple times a day to help control other, like you said, addictive behaviors. Sometimes people have gastric motility issues. And what I mean by that is the body doesn't move the gastric contents along the gastrointestinal tract enough. Sometimes low-dose naltrexone can do that. It's great at reducing gastrointestinal inflammation. So we'll talk about some of the conditions moving forward. So keep in mind, the top providers that we see that will write low-dose naltrexone, we see a lot of our integrative medicine practitioners, our functional medicine practitioners, chronic pain doctors. We've got some of them that are starting to write for it, trying to get people off of opioids. Family practice practitioners. I have a lot of them that are a lot more open and willing to write it, because the thing I've learned and mental health practitioners, and we'll talk about that, why that is. What we've seen through the years, unfortunately, is a lot of the specialists, they're so in their craft, and I have nothing bad to say about it, but they tend to be very what's called allopathic trained, which is kind of by the book. And unfortunately, much of the healthcare education that's taught to practitioners, whether it be us in pharmacy school, doctors in medical school, osteopaths, is very big pharma, and it's all about big drugs, and it's all about that. Unfortunately, there's not a lot to be made in low-dose naltrexone. It's a very cheap drug. It's not very expensive. And unfortunately, what we see is it just doesn't get trained. So unless we as practitioners and you as a patient educate yourself and train on this, it's kind of hard, but we can talk about some ways to get practitioners to understand and move forward. I want to talk about, I can do 10 screens of potential uses for LDN. And at the very end, I'm going to give you a website that I highly encourage you to go to and type in any condition you want. And there's phenomenal information. But I want to talk about, I highlighted some in red, some of the bigger ones that we see with some of the biggest benefit. We're going to talk about this. So any autoimmune condition, and once again, I said there's about 104, 105 autoimmune conditions now. We're learning more and more every day. Multiple sclerosis, keep in mind, that's an autoimmune condition where the body attacks the sheath that lines your nerves, which can cause all types of muscle issues. And it's really can be very degenerative over time where people can't function, they can't walk, and they lose mobility. Multiple sclerosis, there's some really great stuff that talks about its use of multiple sclerosis. One of the things we see is people with multiple sclerosis within the first couple of weeks do great. And then all of a sudden they will just nosedive with low dose naltrexone, and then get worse. But then typically the worse you get afterwards, you'll rebound and be that much better. We see really good benefits of multiple sclerosis. Probably the most common thing that we do LDN for is Hashimoto's. Hashimoto's is a condition where your body attacks its thyroid gland here. And unfortunately with Hashimoto's, it causes an erratic thyroid. And our thyroid hormone controls so many things in the body. And unfortunately, our thyroid, when it gets out of whack, it affects our metabolism, our brain health, our hormones. And so Hashimoto's is an autoimmune thyroid condition. Highly recommend if you're on a thyroid med and your doctor has never checked you for Hashimoto's, please have them check you. It's super important because I would say almost 50 to 60% of our patients on thyroid meds have Hashimoto's. Well, low-dose naltrexone can actually calm Hashimoto's. If we can catch it early enough, I've actually seen some patients where the body doesn't destroy the whole thyroid, and we actually can lower and get them off their thyroid meds because the body stops attacking the thyroid gland. Big name. Rheumatoid arthritis, the body begins to destroy the joints. It's very good for preventing that in terms of the anti-inflammatory and the autoimmune condition with that. Your gastrointestinal conditions, ulcerative colitis, Crohn's disease, IBS, IBD, and like IBS and IBD are examples of conditions that honestly doctors have nothing to treat people with. It's just a condition where you either have chronic bloating and you have a lot of diarrhea, you may have chronic constipation. They give these medicines that kind of help with symptoms. I will tell you, low-dose naltrexone can be amazing with what it does. And once again, it's super safe. It doesn't have all the side effects. It's a cheap drug. We've had some patients with Crohn's disease, which is basically a condition where the inner gastrointestinal tract is just full of ulcers. The biologics on the market are kind of the go-to drugs. I've actually had a couple of patients with Crohn's who've been able to get off their biologic. Once again, we're going to talk about at the end, LDN isn't the end-all cure-all. There's other things you must do as a patient to heal yourself. But as one piece of that healing puzzle, LDN can be a tremendous benefit to kind of move the needle in the right way. Psoriasis, we talked about. Psoriasis is really important to understand that, you have to be able to give it some time. The skin conditions, what we've learned, are some of the slowest to resolve with LDN. But I'll kind of show you a picture at the end of a child that had psoriasis and what low-dose naltrexone can do. Other conditions, just want to kind of go, and these are some of the more recent ones, chronic pain syndromes that really doctors have nothing to treat. Fibromyalgia, chronic fatigue. Once again, it's inflammation that typically makes our mitochondria, the powerhouses of the cell, not be proficient in making energy. Low-dose naltrexone has been very beneficial for that. Depression and anxiety, it's funny, I was sitting with a practitioner the other night at an event last night, and he was telling me, he's like, he said, I had a patient the other day that he was treating her Hashimoto's with low-dose naltrexone. And he said, I really appreciate you treating my thyroid, but he said, she goes, I don't know what you're doing, but the medicine you gave me for my anxiety depression has been outstanding. And once again, as a side effect, LDN actually in the brain is tremendous for helping with anxiety depression, especially when nothing else works. And I think what we're learning over time is it really has more to do with what the inflammation in the gut and how our gut and brain talk to each other. And I really do think that's one of the biggest benefits that LDN does. It works on the neurotransmitters, it works on inflammation. Long COVID. This is another one. I've got one practitioner that's here in the Woodlands area that's got a whole protocol for long COVID symptoms. And that has to do with, the excess clotting, brain fog, fatigue, tiredness, muscle weakness, just no stamina, breathing issues, lung issues. And he's got a regimen that he does of low-dose naltrexone, and he uses another antibiotic. that he's had. I mean, he tells me he's probably at 70 to 80% response on helping people get their lives back from long COVID. So we'll go into some stuff at the end, but I just want to bring that up. That's one of the real benefits that can be found. Let's talk about some of the precautions with LDN. I don't want to paint it and make it out to be anything more than what it is. You can't take it with opioids like we talked about. So if you're on an opioid, we can't start you on it, even with things like simple ones like codeine and tramadol. Sometimes I get people like, oh my gosh, what do I have to go in for a dental procedure? Very simple. We just, once again, remember we talked about it gets in and out of the body fast. That's how it works. As long as you stop at 24 to 48 hours before you need to take an opioid, that will allow you then to get it out of your system. You can take the opioid, have your dental procedure, take the pain med. We can get back on it. Honestly, as long as you haven't been off of the low dose naltrexone for more than 7 days, then you can actually start the naltrexone right back where you were and still get the benefit. We got to monitor our blood sugar and thyroid levels once on LDN. Like we talked about with Hashimoto's, your thyroid may start working again. And all of a sudden I've had calls where, oh my gosh, my heart's beating out of my chest, and come to find out their thyroid's working good again. And the thyroid med they're on, now they have too much thyroid. It can cause what's called a tachycardia or rapid heart rate. Doctors need to monitor your thyroid levels really between like 8 weeks after starting LDN, because it can have that effect. It reduces inflammation. I've seen people have improved blood sugar readings because of that. And if they're on insulins, that can be very careful. You have to be very careful with that. Side effects, once again, I have found through the years, as long as we start low and go slow, we don't see a lot of side effects. Early on, it was thought you had to take low-dose naltrexone at night because we naturally make our endorphins while we sleep. And if we do that blockade at night and pile on, we may get more. But what we've found is it causes incredibly vivid dreams. It really doesn't affect sleep as much. But what happens is, I use this analogy. Let's say your dog died a year ago and you take low-dose naltrexone. And you'll have one of these dreams, you'll wake up in the morning and you will think your dog is still alive. And then people like freak out about that and like, I don't really like that. So what we have found is if we take it earlier in the day, we still get the benefit of low-dose naltrexone, but we don't get quite the crazy vivid dreams. It can cause some mild headache and neck pain. And what I've seen that is when we go up in the dose, sometimes if we overshoot, we just drop the dose back down and those typically go away. Constipation could be another issue. It works great in the gut to control inflammation. But on that same line, we talked about sometimes it can cause constipation. And if that happens, all we really do is we can change it. We can do like a sublingual troche. We can also do it as a cream on the skin where it gets in the body by not going through the stomach as far as that goes. And once again, please keep putting your questions on the thing. I will have time at the end and I'll definitely answer them, even if we have to go over our time. So there's a pharmacy about 5 or 6 years ago that was like, they were the first ones to do LDN, and they went and they interviewed a lot of their patients. And what they did is they did a report and they just said, what are you taking low-dose naltrexone? And if you're taking it, did you feel like it got better? And I think they interviewed about 2,000 patients. And what's amazing is out of all the people they interviewed, about 84.2% of the people said, hey, they had therapeutic success. They were better after LDN than when they started. And I don't know if you know about drug research in the United States, but if we can find a drug that had 84.2% success, it would be the biggest blockbuster drug in history. So I just want to kind of let you know that as far as that goes. So part of that research study, these were some of the things that got brought up, and I wanted to share some of these are actual quotes from patients with LDN. We get these same quotes all the time. I just thought these were great. 24 hours after starting the 1.5 milligram of LDN, I could move my knee without pain. 36 hours after 1.5 of LDN, I can move my knee without any pain and normal range of motion. So that's for like a knee pain, knee inflammation. Here's a psoriasis. My psoriasis is 95% improved. I can flex my thumb, hold a pencil, and now I've noticed, now I'm not noticed in public. I'm able to walk with my children to school and I have so much more energy. I was able to discontinue the gabapentin completely. Gabapentin is a medicine that sometimes people have what are called psoriatic arthritis, where it begins to attack the joints. I'm attending college this fall. I feel normal. I have my life back. I noticed a slight mood lift the first week. Then on the second week, a little better. Then my sleep got better. Then my mood for sure got better. Husband noticed me smiling more and laughing. The brain fog is going away, and I'm able to recall names of people I've known forever. My focus is much better too. I would say that's one of the biggest things we get when people start low-dose naltrexone. We talked about that dopamine hit. I have a lot of patients that not only like their aches and pains are gone, but they just kind of have an overall sense of feeling better, especially for people that are trying to lose weight. Maybe they feel like they're more willing to go outside and walk and be active. So it's really pretty amazing And I'm really not over exaggerating. We see this more often than not. And then the last one's very energetic, not tired, very focused, not moody, concentration is good. I was at a talk about a little bit over a year ago, and there's a doctor, Dr. Zilsdorf. She's a practitioner in the northern U.S., and she did this study where she sent out a survey out to like 2,500 of her patients who were taking low-dose naltrexone for thyroid, and she got 479 back. And what she basically asked them was your global impression, like how things change with your autoimmune thyroid condition since you started low-dose naltrexone. This is quite amazing. That if you look at this, out of 479 respondents, only out of the respondents that were only 1% said very much worsened, minimally worsened. So 97%, well, let's go back, and even the 14 here. So 17% basically had no change or got worse. Once again, this kind of ties back to what we talked about earlier. 83% either were minimally improved, much improved, very much improved. And once again, I know these for any of the practitioners, because I know we have some doctors and practitioners on here. I know these aren't double-blind, placebo-controlled studies, which are the gold standard. We don't have the financial means to do that, but we've been very active in trying to engage our patients in non-biased ways to get feedback. And I will tell you, and no, this is a norm, not an exception to what we commonly see. This is kind of a cool story. This was a small child that had psoriasis on their hands, looked horrible. And one of the neat things we can do with naltrexone, you don't have to take it by mouth. We actually can put it into a cream. And there was a compounded cream that was done for this child. And after 6 months of doing a topical naltrexone, this was the child's hands after. So keep in mind, a lot of times with these kids with these psoriasis, we have to use very high dose steroids, a lot of side effects. It's quite amazing what we can do with low-dose naltrexone, even on a topical sense for some of the skin conditions. Just thought I would share that. I always find that quite interesting. I want to kind of go into some things. Some people are on low-dose naltrexone that are on our call tonight. And I want to talk about what are things that we can do to make LDN work better. Well, one thing is take vitamin D. Vitamin D is involved in about 400 processes in the body. It modulates the immune system. It modulates inflammation, so taking vitamin D is important. Any supplements we know that can reduce inflammation and pain, a high-quality fish oil, magnesium, curcumin, and a good probiotic, because we're learning a lot of inflammation is by inflammation in the gut, which triggers a lot of other pathways. And then the last thing I'll tell you, we get a lot of calls about low-dose naltrexone and quality. Like we talked about, it is milligram doses of low-dose naltrexone. Making low-dose naltrexone is not an easy process in our compound lab. We buy a very high-quality low-dose naltrexone. We test all our staff to make sure they're quality at making it. And what's super important is just because you can find low-dose naltrexone on the internet at some out-of-state pharmacy for cheaper, be really careful, because I've had people switch to low-dose naltrexone outside of us and come back, so like theirs just doesn't work as well. The other thing is many people on low-dose naltrexone are so sensitive to many chemicals. I would say it's some of the most challenging patients that we have. And what's neat is we have the ability to adjust the filler that's in there. Right now, we use something called microcrystalline cellulose. It's an inert plant substance that most people, I would say 99% of the low-dose naltrexone we compound is that. But I do have some patients that are like, I can't tolerate that. So sometimes we'll do magnesium as a filler. We'll do a probiotic as a filler. We do ginger as a filler. I've got some patients that can only tolerate arrowroot. We do arrowroot as a filler. So keep in mind, that's one of the things we want to be careful. You know, I kind of talked about low-dose naltrexone and pricing. I will say to get started on low-dose naltrexone, it's probably about a $60 to $70 venture. But once you get your sweet spot dose where we combine it and put it all in one capsule, low-dose naltrexone is probably between $30, $40 a month. So I realize, you know, for some people, that is a lot of money. But I will tell you, for what the drug does compared to a biologic that's thousands of dollars with a lot of side effects, I don't see why low-dose naltrexone isn't something used more commonly as a go-to, just because, like you said, the cost of what all is involved. One last thing I want to talk about is low-dose naltrexone is not the end-all be-all. It is one piece of your healthcare puzzle to get you going. So I like to talk about what are other things you can do to maximize your health using low-dose naltrexone. We've got to work on diet. You've got to eat an anti-inflammatory diet. Food triggers. If you don't know how to do that, you can Google Mediterranean diet. I have pharmacists on staff that you can book an appointment with, that we can help you tailor an anti-inflammatory diet for yourself. Maximizing vitamins and supplements. We have a vitamin nutrient test. We can do an intracellular blood test for you to look at about 35 vitamins and minerals, and not just look at what's floating around your blood, but look at the vitamins and minerals in your cells. Optimizing that is very important. Many people are on so many medications that cause nutrient depletions, and this vitamins and testing that we can do really works well. Optimizing thyroid and hormones. Your body has to have optimal thyroid and hormones. It's a symphony of all those together, that if we don't have those under control, those can feed inflammation. And without those, the body can't heal. We got to heal the gut. That's another whole lecture for another day, but it starts in your gut. If you don't have a healthy gut, you're going to struggle. And we got to control stress. I know many of us are so busy, we burn the candle at both ends. We're working 2 jobs to pay the bills. We've got to learn to control stuff. We've got to learn. I have so many patients that you've got to find time to take that 20, 30 minutes, at least a couple times a week of me time, which I am guilty of myself, but I try to do better, of yoga or meditation or chai tea to calm our cortisol levels, because our cortisol feeds inflammation and sets us up for the autoimmune conditions. We got to get better sleep. We have a in-store class next week. My resident is putting on about sleep. If you don't sleep at night, 7 hours or more of good quality sleep, our body can't heal. Our body has a natural and immune, kind of a natural like garbage disposal system in the brain, that you have to get good quality sleep at night for to go through and just kind of clean all the junk out of the brain, so you start tomorrow fresh. When you have brain fog and all that, if you don't get good sleep, we're going to really struggle with that. We have a in-store education thing on sleep next week. If you can join us, we'd love to have you be here. Resources. The best patients are those that are educated. We are here to provide all the education you need, and I hope you take advantage. We offer consults by appointment. We can work with your practitioner. But the LDN Research Trust is a wonderful site. You can go in there and read about Linda Elsegood. She started out on her own. She was a patient that was basically in a bed, confined, could not function because of her medical conditions of autoimmune. That LDN allowed her to get her life back to the point. She does all this on her time. I worry about her. She spends a lot of time and effort to do it. On the LDN Research Trust website, you can go on there and learn. Like I told you, you can put in any medical condition and learn. There's 3 LDN books. The LDN 3 book is the newest one. Each one of them, the beginning chapters on all of them are all the same. It talks about LDN and how it worked. Very good overview, kind of what I gave you tonight. And then it breaks down certain medical conditions. You might look to see if you're more into like pain and PTSD and IBD, book 2 may be better. If you want to read about LDN for long COVID, this LDN book 3 is great. So we have those here at the store. You can go online and buy them. Highly recommend you to educate yourself and do those. So that's what I have for tonight's talk. I'm going to unshare my screen. And then what I'm going to do is I'm going to do my best to blow through questions. And then if we have any extra time, more than glad to take more as far as that goes. So let me pull up chat. I see there's 34 in here. I will do my best. And I know Haley's been trying to help, and I'll try to go through and answer all that I can. And once again, so you're still welcome to put your stuff in chat as far as that goes. One of the things too, let's see here, the conditions. I know Haley put the LDN Research Trust in the chat. Yes, the one question is, does anyone use traumatic brain injury or Alzheimer's? Yes. So what we know is when we have traumatic brain injury and even Alzheimer's, it is an inflammation in the brain. Very, very important to understand that. With that, a lot of times when you cut on what's called the microglial cells in the brain, they don't cut off on their own. Once again, we talked about LDN reduces inflammation. I do have a lot of practitioners that use LDN for traumatic brain injury. We also have some other things, some things with compound that we do that also can reduce the microglial inflammation, but those are some things to look at. There's a question about LDN. I actually have some buddies that are starting to look at LDN for dry eyes and pain in the eye. That's something, I appreciate that question, Sarah. I'll tell you, if you'll reach out to me afterwards, and you call me at the pharmacy, I'm more than glad to talk. We're not doing it now. I do have some buddies of mine that are doing it, but if something you want us to look at to work with your doctor, I am more than glad to try that. But I do have some friends that are starting to do low dose naltrexone eye drops that are really, really good for dry eyes. So more than glad to help on that. Let's talk about eczema. I definitely think there's definitely any type of skin condition. I'm going to tell you my own personal belief with many skin conditions is we're treating at this, your inflammation in your body rears its ugly head as a skin condition. but the inflammation's in the body, and 9 times out of 10, it's the gut. If we take patients and put them on an anti-inflammatory diet, do things like glutamine and different things to heal the gut lining so that bad things don't get out of the gut, and then we do things like low-dose naltrexone to calm inflammation, we have had phenomenal results in helping patients with skin conditions as far as that goes. As far as seizure activity, there actually is some studies about using low-dose naltrexone for seizures. It's not going to hurt anybody. Once again, there's really only 2 things you really can't take low-dose naltrexone with. One is opioids, and the other thing is if you're an organ transplant patient and you're taking rejection drugs, I will not recommend it unless you talk to your doctor. There are some patients that do it, but that's not something that I would recommend. The weird dreams can happen at all doses as far as that goes. So I just want to stress that. What I found is just taking it earlier in the day is the way to go in terms of preventing that as far as that goes. I will say in terms of weight and BMI, it doesn't matter. Everybody's brain's a little different. Everybody's sweet spot's a little different. What I found is the people that come in with things like fibromyalgia, chronic regional pain syndromes, some of these mold toxicities, long COVID, we typically start and do lower doses because they're way more sensitive to the drug. And I think part of it is the immune system is just so out of balance and out of check. And all of a sudden we start trying to put it back in a box. The body reacts that way. So that's one of the things to look at. How to convince a rheumatologist. I would say get the LDN book. Everything in the LDN book is referenced. The other thing that I would recommend is you can do something that's called PubMed. PubMed is the go-to for every medical professional to look for journal articles. What I recommend, and I'll put that and I'll just tell you, if you just go to a website and Google PubMed in a Google search, PUBMED, go to PubMed and look at that. All you gotta do with the search bar, it's just like a Google search. Put in low-dose naltrexone or just put in naltrexone and rheumatoid arthritis. You're gonna get 5 or 6 quality articles that I recommend. Carry into your rheumatologist. Let them look at it. And I've learned in healthcare nowadays is you as the patient, you drive the bus. There are phenomenal healthcare providers out there that sometimes they just need to be shown that this is available. And there are I think there's over 2,000 current LDN articles on PubMed, which once again is the place that practitioners go to learn that are published studies. Highly recommend you go on PubMed and look at those. Trying to read this next one. Yes, I mean, it can definitely help with Hashimoto's. There are different conditions like on the nephron. It won't hurt you. Even low-dose naltrexone, if you look at the naltrexone handout, it talks about liver conditions and it may increase liver. I have never seen with the low-dose that being a problem. I will tell you this much, even if you're on a biologic, I have seen doctors add, the patient with Crohn's was on a biologic, they can add the LDN, it won't hurt you at all. And then doctors can monitor things. Well, think about fertility. What's pretty amazing, there are doctors in this country that are using low-dose naltrexone to help fertility. We've had multiple patients that'll call us up and say, oh my gosh, I just found out I'm pregnant on LDN, or really wasn't even trying to get pregnant. We have learned through the years, stress and inflammation prevent the body from getting pregnant. It's the body's natural way to prevent a pregnancy in a bad state. LDN reduces inflammation. LDN is used in some fertility centers to improve a chance of getting pregnant. Whether or not you stay on it once you're pregnant, that's kind of up to you and your practitioner, but it definitely can make you more fertile and it can definitely be used in infertility. No doubt about it, IBS, IBSD with or without, with constipation, highly recommend you go online and search a condition. I will tell you, the other thing is too, there's a lot of stuff on LDN research about chronic regional pain syndrome, and there's nothing really to treat that. Next question. Try to read real quickly. If I heard it correctly, it seems long. But once again, most people, we can work your dose up in a matter of 1 month to 3 months. We can get you to your sweet spot dose. But it is once you get to that sweet spot dose, trying to stay on it that 3 to 12 month period to see what your benefit is. Once again, after that time, it's not overly expensive. You can get off of it. You can cold turkey. There's actually some stuff about people who have been on low dose naltrexone. And we see this a lot. People are like, okay, I don't think it does much anymore. I'm going to get off of it. And they'll get off of it. And they'll do really good for about a month or two. And we see this about 4 to 8 week window, and all of a sudden this inflammation comes back, and people are like, oh, okay, I didn't realize kind of what it was doing for me. We kind of see that a lot. Evidence about ADHD possibility, I would say go on the LDN Research Trust. You may find some information. I don't see it really used a lot for that, but that's a great topic that could be looked at. How do we find doctors that are educated to prescribe LDN? There's a couple on this call tonight that in a second, if I get a chance, I may let them unmute themselves and just say who they are and where they practice at. I'll allow them to do that. If you want to know, feel free to call our pharmacy. I am more than glad to provide you information or practitioners in your area, because I know we've got some people on this webinar that are from all over the Houston area and all over the state. We work with practitioners. We are a member of the LDN Research Trust Society. So we work real closely with a lot of practitioners that are very educated. Glad to help with that. Yes, and talked about Contrave is a weight loss medication that's actually got a higher doses of naltrexone, actually up to 25 milligrams. We do some weight loss combos, not with Wellbutrin. We do some, but we do some other ones with drugs like phentermine and chromium and low dose naltrexone that we still stick with our anywhere between 2, sometimes we'll go to 6, sometimes we'll go to 9 milligrams of naltrexone to cut cravings, but we've had some really, really good success with that. So you can get by with even lower doses than what's on the Contrave. On using it topically for vein inflammation, topical works. I will tell you, topical is not quite as effective. You've got a lot of systemic skin inflammation. We do some topicals, topical wise, especially if you've got an itch. Topical naltrexone is fabulous for that. I will tell you what we'll do. I have no problem pushing out our presentation. If you registered for tonight, we have your email. We can push the presentation out. We are recording it, so we will have the ability to have the recording out, and we will email out how to get access to the recording. We may put it on our social media sites and on our YouTube channel as far as that goes. Trying to read one of the next ones. For chronic pain patients, what's the approximate time frame that we can tell them to take LDN before they have a benefit? I will tell you, with a lot of patients, we've seen pain benefit right off the bat within a couple days, just because it so dramatically reduces inflammation. If that pain is inflammation driven, we see that. And what I tell practitioners is, you know, your patient's going to be your best guide in terms of how fast you can move with it. I'd like to get the dose up as fast as we can, but the benefits we've seen, it can happen within a couple days, but we have to be realistic. These people have had pain for years, so it may take weeks to a month. But as long as, once again, we're seeing some progression, things getting better as we raise the dose, I think that's what we're looking for. Can a patient take LDN? Accidental gluten intake occurs on celiac patients. They can definitely take it. There are celiac patients that help to reduce the inflammation in the gut. It won't have, is it going to prevent them or protect them with an accidental gluten exposure? Probably not. I mean, it may help things. I'm not going to say it's going to protect them. I know there are some dietary enzymes that are pretty good for that are not an end-all be-all. But if you get a rare exposure to your celiac, I know it may be helpful. Interested in side effects. I don't sleep well. I'll be honest with you. I tell that a lot, and that's one worry is like, oh my gosh, you mentioned it's going to affect my sleep. I will tell you, if most people take it in the morning, it's out of the system. I have very little issues with that. Once again, if we do have sleep issues, we just bump the dose back and start slowly. A lot of times people become more tolerant than that and tends to go really, really well. I don't know if the LDN books are in Spanish. That is a great point. I will try to see I know if you go to the LDN Research Trust, that may be a good place to look for that. Appreciate all the shout outs and the thank yous as far as that goes. My TSH is currently in the 30s, even on meds. Does thyroid have to be in range? It doesn't. And I'll just tell you, actually, if we can get this started earlier on in Hashimoto's patients, I would almost tell you, I'd rather see, you know, if you've got a TSH of a 30, that's very, very bad. But if you've just got a sluggish thyroid, which TSH is a marker of how our thyroid function is working. If your TSH is just a little bad and your doctor checks your thyroid antibodies and you do have Hashimoto's, I think trying LDN is a great choice before we even try thyroid meds. Unless, once again, the thyroid is really out of whack. Once again, I'm not trying to give medical advice. I'm just giving some suggestions. I've seen that done by some practitioners. Cancer patients and radiation and chemotherapy. There's a lot of great information on that website and in these books. I will tell you, I don't want to get into this tonight, but I've had some amazing stories with cancer. I don't want to make it out more than what it is, but we've had some dramatic cancer remissions by people starting LDN. It's amazing what it can do. I don't want to sell it for more than what it is, but there's some great information. And you'd have to check with the doctor about the chemotherapy and radiation, but I know there are some patients that are being allowed to do it with those. Once again, it can be used for any type of pain post-surgery as long as somebody's not on a narcotic. If you are, we can do some ultra low dose naltrexone, which is something else that we can do. And I think that gets me to the end of the questions. We've got 2 minutes left. If there are any practitioners that are on tonight, if you want to unmute yourself and introduce yourself, if you do prescribe LDN, you're more than glad to say where you're at, what the name of your practice is. I'm glad for you to share that. Feel free to do that, and I'll kind of open that up right now if anybody would like to do that. Dr. Yellen, I see you unmuted yourself. Are you using LDN in your practice? All right. That is all I have for tonight. I hope you found it useful. I appreciate you taking time out of your busy schedule. If you have any questions about LDN after tonight's webinar, you feel free to contact our pharmacy. We will, after this, we will push out the recording, the slides. With that, I'll give you a couple contact emails so that you can reach out and get in touch with you, have questions about LDN, help you find a practitioner. But really just want to thank you for your time tonight. I hope you found this beneficial. We're going to try to do probably one of these a little more often. We may do some other conditions like thyroid and stuff. So, but we really just appreciate your time joining, trying to learn a little bit about LDN and how it may help your health conditions. But thank you all very, very much. Hope you have a great night. And thanks so much for joining tonight's meeting.